Hello everyone for another Plab 2 Station with Dr. Al. Someone asked me about diabetes. They said, why have you ever spoke about it? Diabetes in Plab is very wild. It could be patient coming to rationalize diabetes medication. Type 2 patient, follow up, you need to go through the tablets. As I discussed in my previous videos, when you go through the tablets one by one, safety net, side effect, how to take, when to take. It could be a patient with diabetes who came urgently to A&E for hypoglycemic episode. In this case, you need to know how to manage hypoglycemic episode. You need to understand, does the patient have conscious to take small history or the patient does not, and you just need to manage. It could be complication of diabetes. Could be, for example, diabetic retinopathy, and you have to examine an eye. Diabetes is very wide. You have to be absolutely on top of things in this because it's very common. Hypothetically speaking, for the sake of this video, let's talk about diabetic retinopathy. So a patient presented to you with vision issues. You start with the history, you discover the vision, you dive into other past medical conditions. The patient only has diabetes. Oh, okay, you have diabetes. Would that be type 1 or type 2? Doctor, I have type 2. Is it under control? No, doctor, it's not under control. I find it very hard to control by BMs. Thank you for that. Do you eat well? No. Do you smoke? I do. Do you drink? I do. You have a lot of risk factors. Then you verbalize what you need to examine. There are some things that I need to point out. So if it's a station like this where the patient presented with issue with the eye and you kind of think this is diabetes retinopathy. When you examine, you need to examine the visual acuity, visual field. You want to do fundoscopy as well. You want to examine BMI. Don't forget, type 2 diabetes comes well with metabolic syndrome. You want to get BMs, bedside BMs, random capillary blood sugars. And you want to get a BMI. Once you name all of these, they will probably hand you over the result. If not, carry on normally. What you have is diabetes retinopathy. You see if the patient needs referral. You manage this because you basically, all you have to do is refer to diabetic clinic and they will manage this. Diabetic services. You have to give advice about lifestyle, diet. You have to give advice about tablet. What tablet are you usually on? Why have you not been taking them? Is it the side effect? For example, if I'm on metformin and I'm not taking it for diarrhea, what are you going to do? You're going to give me modified release metformin, okay? So it's always finding solution for what you have.